Hi, everyone. It's Michael Tubbs here, Brookdale, Potomac. We're lucky enough to have Jamie here with us today from Captial City Nurses. She's going to go over some information about in-home care and some changes that Captial City's made during this time due to COVID-19 and hopefully give you some useful information. So Jamie, thanks so much for joining me today.
Yeah, thanks for inviting me here to share about our services. I appreciate it.
Well, perfect. Well, tell me a little bit about Captial City Captial City Nurses and in-home care.
Yeah, absolutely. So Captial City Nurses, we are a private duty caregiving agency. And we've been around for 44 years, so a long time in this community. And we provide one-on-one care support for people at homes and sometimes even in communities. Our services, they're not covered by insurance, so it's a little different if you were going to get like skilled home care. So it's private pay, and we do take long-term care insurances. So if somebody does have that, we can help them understand their benefits, and sometimes they can get reimbursed for some of their home care.
Okay.
Yeah, so private duty Captial City Nurses, we provide caregivers that go into the homes and do one-on-one care, such as we help with things called activities of daily living. And this is bathing, toileting, maybe dressing, personal hygiene, safety with transfers. So some of that is the main things that we do. But we also help with a lot of other lighter things like household cleaning. We help with dishes, laundry, such as if laundry is in the basement and it's hard to get there, maybe not safe. We can help with some of those things, as well as like meal preparation and getting groceries and even picking up like medications.
Oh, wow. So you guys help out with transportation as well too, or just running errands?
We can help with transportation. So many of our caregivers do drive. So if that is a requirement, we will make sure that we have a caregiver that can drive. They can take the client out. Whether it's for coffee, groceries, like I said, even to doctor's appointments. So sometimes that's a challenge. If you're living alone and you have some needs where you need extra help and maybe family isn't nearby and they can't really, help as much. So our caregivers can drive if it's requested.
That's great. If I'm a family member and let's say I have a loved one and I'm out of state, or even in state, what are some indicators or some signs that someone might benefit from in-home care?
Well, definitely. I think as if you have a loved one nearby and maybe they're developing other medical conditions, or maybe they're getting more forgetful, maybe they're not really staying on top of their medicines like they should, and you're finding that that's becoming a problem. Our caregivers can also give like medication reminders to them. That might be a sign that there's some extra help. Maybe you notice maybe they've had increased falls and maybe they've gotten lucky and they haven't hurt themselves, but they might need that little extra safety there for when they're going to the bathroom, or maybe they're getting up in the middle of the night. They can help with some home safety, making sure that things aren't cluttered, so again, they don't fall. And just maybe their personal hygiene. Maybe if you're finding when you're visiting them that maybe they're getting like increased urinary tract infections, or they're just really not taking care of their self-care as well. That is a reason maybe you would think that they could need some extra help. And it can be as a couple days a week for a few hours to something more comprehensive, if 24/7 care, if that was absolutely necessary. Or if somebody's just come out of the hospital or something and they're kind of a high risk for a few weeks, sometimes they might need some extra eyes on the loved one while they're recovering.
And during that recovery time, I know a lot of times people who coming out of the hospital or coming out of, let's say, a skilled nursing setting, they're sent home with some home exercises to do. Are the home care aides able to help encourage and actually facilitate exercise programs that have been assigned by physical and occupational therapy, or how would that work?
That's a great question. Definitely, when someone's had a hospitalization or a decline and they have skilled PT and occupational therapy in their home, and they're working with them, our caregivers that are there more for a longer period of time, they can help with the maintenance of those programs. because sometimes they come in, the PTs come in, and I'm very familiar with this process, that it's hard to carry over, and maybe they don't have that cueing or support. So that caregiver is there to, first of all, the PT and OT can teach the caregiver to assist. Maybe they have an exercise pages or a booklet to go through, or whatever they've written down for them. And they can kind of cue them, okay, it's time to do this exercise, and they can kind of just help them along. So absolutely, it helps with maintenance.
Yeah,
Again, trying to just have a long-term benefit.
that's great. And any changes that your caregivers are doing now going in the home to help prevent the spread of COVID-19 and the changes that that's had on your company?
Yeah, so our caregivers that are going into the homes, we obviously, as a company, everyone has a heightened awareness of coronavirus and how easily it spreads. So our infection control measures are being held to the max standards right now. Our caregivers are going through mandatory training for COVID-19, and they're taking a test to show that they're familiar, with transmission and all the infection control that we're going through. Our company has obviously increased our use of personal protective equipment, so PPE, and we're very stocked up, and we've been giving our caregivers the things that they need in the home, and also encouraging our clients. We're also screening our clients too, so for them to wear masks. So everyone just has this really a higher level of awareness so that we can keep everybody safe right now. I mean, our company is also doing things as a whole too, to address COVID-19. And we have a COVID-19 task force with our director of nursing and a team that meets several times a week. We try to address anything concerns that come up COVID related for caregivers, for our clients, and even in communities that we're working with, because our primary goal is to keep everybody safe. So we're doing a lot of, and it's constantly changing. I mean, you probably see it on your end. This is an evolving process, and it's tough for everybody. And I think Brookdale, as well as Captial City Nurses, is pretty on top of their game as far as evolving their policies as needed.
Yeah, I think similar to Capitol City, Brookdale's been in the industry for over 40 years as well, and having that longevity working in healthcare. We've never seen anything like COVID-19, but we have seen other situations pop up where precautionary measures need to be in place, such as wearing PPE and how to put on the gowns correctly, doff the gowns correctly, and make sure that we're keeping residents safe here, and obviously for you guys in the home as well. So yeah, it's been a change. It's been a lot of calls and a lot of education for all our staff, but it's what's needed right now. So yeah,
absolutely.
Well, anything else that you can share, any insights about Capitol City Nurses or in-home care? And also, if people have more questions for you, what's the best way that they can get in contact with you or Capitol City Nurses?
Well, sure. I'll be happy to provide my cell phone, or you can call the Capitol City Nurses main number, and you could be asked to speak with me or another home care specialist. Because what I do is I speak with families about their unique needs, and try to find a schedule of how we can best meet your needs, and then and your budget as well. So I would say, as far as things that I haven't shared, is in the home. Like, I think of in-home care as someone who, it may be someone even that's thinking about they need a little extra help now. They know things are more difficult, but it's also, I think, important, even though you're having in-home care, for families to really think about kind of what the next steps are sometimes if things maybe progress or decline more quickly than they think, and kind of look at those next options, like whether that's assisted living, and do their research ahead of time, because I know a lot of people want to be in their homes, and there's a time that a lot of times they have to go to a community like Brookdale, and it is good. My recommendation is to really do your research before things become more of an emergent situation. And we can help also steer our clients in a direction, and we kind of know sometimes when they kind of need to kind of move in that direction.
Mm-hmm.
So that's probably one thing I think that's important to say. And also with in-home care, just, I think people that are having like caregiver burnout, if they're taking care of a loved one, I mean, that's tough. I mean, we can offer some breaks to helping care for their loved ones so you can kind of pay more attention to your own self-care, which I think is very important,
Hmm.
whether we're in COVID time or not. So that's another area that we can help.
Yeah, and that's as a dementia trainer, that's one of the first things that I teach when I'm working with new classes or new individuals is, the number one thing not to forget is you have to care for yourself, because your self-care directly impacts your care for your loved one as well. So having that time to take those breaks, to be able to do your own self-care and not focus on always being the caregiver, does help you in the long run. So yeah, I definitely recommend that as well.
Yeah, and as far as like my cell phone number, I mean, I can share it. Would you like me to say it now, or I
Yes,
mean, they can always
please.
reach out to you. Yeah, so my cell phone number is 301-318-7730, and I'd be happy to answer any questions. Again, even if you're not sure it's for you, I'm happy to just educate you on the process of how it works to make you feel comfortable when you're doing your research.
Yeah, because the more information you have now, even if it's something that you might not need right now, in that emergency situation, knowing what resources are out there, knowing what's available to you, and how to get things started, take some stress and some pressure off that situation. So that's my recommendation: is do your research early, and it'll help you out in the long run. So, well, Jamie, thank you so much for joining me today. I greatly appreciate it, and stay well and safe during this time.
Thank you. You as well.